Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, a practicing cardiologist here in Houston area for the last 40 years. I have a very important topic I want to discuss with you, and that is demanding the federal government to bring a moratorium on Medicare prescription drug costs. This is an important topic which affects every family here in the United States. So we need to demand the federal government to bring a moratorium on the prescription drug costs, especially for the Medicare population. If you look at this chart that I got from the CMS, which is the Center for Medicare Services, it shows in 2019 there were 61.5 million Medicare recipients. When we are talking about almost 20% of the US population who have been taken for a ride with these prescription drug costs, it is time for the federal government to take charge of these Medicare prescription skyrocketing costs and bring some sanity to this insanity. The seniors have to decide between their prescription drugs for heart failure, diabetes, and kidney failure versus what they're going to have on their dinner plate tonight. Think about it. A little bit about my background. I have been a cardiologist, as I said, for more than 40 years, dealing primarily with the Medicare population. 95% of the medicines I wrote in my practice were of the generic type. There were occasions where I had to write a blood thinner which was new and there was no choice. Still, we were able to get a lot of help for those patients during the early years of the drug introduction. I have a medical degree, MD. In addition to that, I have a Master's in Healthcare Administration from Texas Women's University. So I studied not only the impact of medicine on healthcare, but also international medicine, looking at countries like Canada, Japan, United States, Germany, Australia, all these places, as how they are handling the Medicare population in their countries. In addition to that, ladies and gentlemen, I also have a Texas health and life insurance, and I have been dealing with prescription plans for the last several months, and I can tell you I am in a better position to appreciate the challenges the Medicare population faces better than anyone else in this country. After looking at this Medicare prescription drug costs, I wonder how people who are dependent solely on their Social Security can pay for these astronomical costs of the drugs they have to take just to stay alive. Here, anyone can go to this Medicare.gov and put in your prescription drugs and see what the total cost is going to be per year. And let me walk you through this one, and you'll be surprised as to how many places you've been taken for a ride. First of all, here, 4 or 5 medicines I put together. The total premium, piddly $12.90. Don't let you fool that one. Look at the total cost of the drugs, $4,632 per year. A person getting $1,000 Social Security or a couple getting $2,000 Social Security, you cannot afford to spend $4,600 plus the premium, plus the donut hole, and all these intricacies of a prescription drug program, which is going to drive them to bankruptcy. And here is a breakdown of what the cost is going to be for these patients. Total cost $4,787, and he's going to be paying a deductible of $485 in 2022. In addition to that, he is going to be entering the so-called donut hole, the gap, within February, within 2 months after starting the year. And then you are going to be coming out of this donut hole in March. What is this nonsense? What is this gimmick, Mickey Mouse game, playing on senior citizens who can hardly meet their daily food requirements? And look at individual cost of drugs, $378 for, this is only for like one drug. And look at this cost of this drug, Prolia, which is for osteoporosis, $2,000. And each one of the diabetic drugs cost approximately $1,200 to $1,400 per year. Why am I talking about this retail cost? And you can say, well, I'm only paying $20 my co-pay. No, don't let that fool you. Ladies and gentlemen, there is what is called the deductible. You have the $485 annual deductible in the beginning to start with. So you pay your premium and the first $485 is going to come out of your pocket. Then you continue to pay your co-premium for each drug you get every month. And along that, there's a so-called step therapy. If there's a new drug that is written by your doctor, you are not allowed to take that drug. You have to try some other generic forms, and then they have to approve that drug. After that, you enter the so-called donut hole, which is nonsense. Basically, this is all a Mickey Mouse game, as I said. When you enter the donut hole, you are paying 25% of the drug cost. When they calculate the drug cost, it is not the copay $20 you are paying. It is the $1,200, the list price the pharmacies say they are paying for that particular drug. As a result, you are paying 25% of a $1,200 drug per year. Think about it. Then you have the catastrophic coverage. There is no, when you get a medical problem, diabetes, heart failure, kidney failure, this is a continuum of a healthcare issue for life. There is no thing like tier 1, tier 2, tier 3. All these things, all they do is bring tears to your eyes and to your family members. We need to dismantle all this. And there are countries like Canada, United Kingdom, Germany, France, Japan. All these countries have comprehensive health coverage, including the prescription plan. Why on earth is the United States penalizing the poor Medicare population who are dependent on Social Security for their daily living? Well, I have several proposals which can resolve this issue once and for all for the entire Medicare population involving 61.5 million, and which is growing at a rate of 5 to 7% per year. Number one, the federal government is already managing Medicare Part A and Part B. The Medicare Part A and Part B have been very well managed by the Medicare, and that is an important foundation on which what I'm going to talk and propose is going to make some sense. Medicare should take charge of the Medicare Part D, the prescription plan, and charge $0 to $50 depending upon the ability of the person's income. If there is an executive making $500,000, I'm sure they will be more than happy to spend more than $50 per month, because the cost of some of their medications could run into tens of thousands of dollars. No one would object to paying $100 for prescription premium. Let Medicare take this premium and then deduct it from the Social Security. I know you're sitting there saying, man, you must be crazy. The government is already sucking up so much money from us. Why the hell are you telling the government to take $0 to $50 premium for prescription drugs? Well, I have some very important message for you. Number one, Medicare is already successfully managing Part A. Medicare is managing Part B. And we are talking about 61.5 million people in this country. And the most important point is when the Medicare takes that $50 premium, that can be used to subsidize low-income people. So their co-pays, their premiums will be practically zero. Now, does that make sense? It should. You know, in 2019, the federal government brought about a moratorium on the cost of insulin to $35 per month. It doesn't matter what kind of insulin they take. I mean, that was a lifesaver for diabetic patients who were dependent on several pills plus insulin. Some people are paying $200, $300, $400, $500 just for their diabetic treatment. Now their insulin cost has been sealed at $35 per month. So it has been done, it can be done, it should be done. Similarly, do you remember their Epi-Pen? The drug company jacked up the price to $800 per one injection shot that is used to prevent allergy and sudden death among people who are allergic to certain things like peanuts or ragweed or anything like that. Ladies and gentlemen, this is basically a daytime highway robbery of innocent Medicare population. The second point I would like to emphasize is the federal government should negotiate a max price limit for 95% of the drugs at $10 for 3 months prescription. If any one of the companies are willing to come on board, they are in. If not, they are out. That's it. Simple. And then the extra premium which I told you, $0 to $50, would go to pay towards the low-income people so that their costs would be practically zero to minimal compared to what they are paying now with their lunch and dinner dollars. So the federal government should let these companies which are already in existence like mail order pharmacy, CVS, Kroger, HEB, who are all doing excellent job in containing the cost of these drugs, because I review the medications every day on several patients who are on Medicare prescription plan, and they are all doing a job, but we need to put a ceiling on how much the Medicare population can pay for a given drug so they can budget their gross income and expenses for the whole year. I encourage you to go to medicare.gov and you can look at Part D prescription plan, put your medications and look at the cost and see which pharmacy gives you the lowest of the $10 premium that is a ceiling put by the government. If they give you extra perks, then you go with that pharmacy. So you don't have to worry about sending in somewhere, sitting for 2 weeks and trying to get it in the mail, then going into the donut hole and paying 25% premium on each drug. This is all nonsense. You don't need to go through this one. Because when we were having private insurance, for that matter, when we were working, when we have private insurance, we go to the human resource, we sign a piece of paper, we get United Healthcare, Blue Cross, Aetna, Cigna, Humana, whatever the insurance is, it covered everything. Why on earth are we making the Medicare population suffer the most with the least amount of resources available? Okay, it can be done and it should be done. It has been done with insulin. It has been done with Epi-Pen. So ladies and gentlemen, the government should dismantle this $485 deductible, which is not going to help anyone. The donut hole should go away. Eat the donut and get away with the donut. Next, forget about this co-insurance and 25% copay, all this nonsense, because this is not humane to treat American senior citizens. So let's get rid of all these gimmicks. And I tell you, it is a travesty that when somebody works for 10, 20, 30, 40 years, they put their life into paying Social Security and Medicare, for them to be treated this way. So when they are retired, they have to decide between their heart failure, kidney failure, diabetes medicines versus their evening dinner. It should not be that way. So, ladies and gentlemen, in conclusion, I humbly request you to sign the petition which I have on change.org. I want you to call your congressperson and senators and demand that they introduce a bill to bring a moratorium on the prescription drug costs, especially for those 61.5 million Medicare recipients. The congressperson and the senators should be supporting you, the Medicare population, which constitute close to 20% of the United States population. And I also encourage you and your family members and your friends and relatives to share this with their friends and relatives and sign the petition, get the momentum going so that we can bring about a change, because this has been done in every developed country, and America is the only country where the Medicare population suffers the most. And here is the change.org, where you can go and read my petition and sign my petition, and also encourage other people to do so. Share this on your social media, and I'll tell you what, if you want me to come and explain all these things to your senior citizens group or your association, I will be glad to travel to your place at my own cost and explain to you as how this can be done and how this must be done to protect the American senior citizens. Ladies and gentlemen, here is my little contact information. I'm a cardiologist. I also have a NNN media where I talk about various things that affect our daily lives, and you can contact me if you have any questions. Thank you so much for watching this presentation, and please do me a favor, share this video with your friends and families on your social media. Let's get this momentum going so that every one of us, including myself, benefit from bringing a moratorium on the prescription drugs for the Medicare population. And please do subscribe to our YouTube channel. Thank you so much, and I will see you in the next video.